Recent estimates and projections based on the 2005 Demographic and Health Survey findings show that 3% of the entire population aged between 15 and 49 is infected in Rwanda. More disturbing is the fact that mother-to-child HIV transmission prevalence is currently high. This is a worrying sign. To reverse the trend, one of the targeted interventions is the family package, an intervention extending basic care and support to the family members of the HIV-positive pregnant women.
Au niveau national, il y avait déjà des projets de protection.
At the national level, there were already projects related to prevention of mother-to-child transmission of HIV.
La première dame du Rwanda, Madame Jeannette Kagame, a eu l'idée de mettre un peu plus dans ce paquet de services.
The First Lady of Rwanda, Mrs. Jeannette Kagame, had the idea to add more to the package of services, like working not only with HIV-infected pregnant women to provide them with appropriate care for the baby to be born healthy, but also with the whole family, husband and wife, to prevent early orphanhood for the child. We want to protect brothers and sisters to foster a conducive environment for the child.
Les frères et sœurs pour donner un bon environnement à l'enfant.
The family package was launched in February 2002 as a pilot initiative at Kakiru Health Center, Gasabo district of Kigali City, to be extended to some other health centers across the country, namely Matyazo, Centre Universitaire de Santé Publique de Butare, Muhura, Gisenyi, and Nyamata, as an approach built on the benefits of the existing prevention of mother-to-child transmission interventions, PMTCT.
The family package est plus.
The family package is more than the usual PMTCT that is implemented elsewhere.
Ordinaire qui se fait ailleurs.
It was a very innovative program because it is the first of the kind the world over that takes into account the family approach rather than an individual approach in supporting people living with HIV. This is what we can qualify PMTCT++. The approach has been acknowledged as the most profitable and sustainable, that now it is adopted as a universal approach.
Universelle.
Preventing mother-to-child transmission through the family package involved interrelated strategies, voluntary counseling and testing for all pregnant women, comprehensive care of family planning, counseling and services, psychosocial support, appropriate ARV therapy and treatment of sexually transmitted infections and opportunistic infection, subscription of membership to Mutuelle de Santé, nutrition support, information on safe infant feeding and safe delivery practices, support with income-generating activities for the sustainability of the program. Access to voluntary counseling and testing for pregnant women and their families is a critical aspect of prevention, harmony in the household and care.
I am HIV positive, but my wife is safe. We live together in harmony. You wouldn't suspect anything in our household. You wouldn't notice that our couple is discordant.
We communicate positively and share tolerance and mutual respect. We have 6 children and a 7th we adopted.
Complications of pregnancy and childbirth are among the leading causes of illness and death for Rwandan women. Most of these deaths can be prevented by appropriate antenatal and obstetric care. Pregnant women enrolled under family package are advised to follow the standard for antenatal consultations, high-quality family planning services, essential to reduce unwanted pregnancies, which can increase HIV risk to both mothers and children. They are also provided with information on safe delivery in a health facility and safe infant feeding practices known to curb the risk of vertical transmission. Antiretroviral therapy, treatment of opportunistic infections and the current sexually transmitted infections, providing the medical insurance, mutuelle de santé, are crucial components of HIV-related care.
I thank God for a regained strength. After I began antiretroviral treatment, I can work and collect school fees for my children. We acknowledge all well-wishers' interventions, which facilitated our access to medical insurance and antiretroviral treatment. I am grateful to the medical doctors who never discriminated against us, but were with us to counsel, as well as the community-based volunteer health workers who offer daily counseling.
Reducing stigma and discrimination against people living with HIV/AIDS and their families is essential to the success of all types of services. Strong responses such as psychosocial and mutual support are a must.
Loneliness and community life are two different situations. Loneliness is loneliness, and group life is what it is. Moreover, the fact that people in your group share in same worries boosts your morale and makes you feel integrated. I was less communicative and avoided being with others, but now I don't have any problem as I feel integrated and communicate well with other members of our association, which brings together members of same conditions. This cheers me and makes me feel very happy. I'm overjoyed.
After I tested HIV positive, I felt hopeless. The family package could help us get together and solve some of our problems. We were told that living with HIV is not an end to life. You may live long with HIV, tend to your daily activities, feel accepted as a human being, because even before you tested HIV positive, you used to lead a normal life.
People can value their potential when in groups. The family package contributed substantially because it initiated the group therapy by giving people activities to perform in teams and earn income. One does no more feel isolated in the community. The person enjoys the community support, peer support, and therefore feels integrated. He or she changes behavior and mindset to become active in the society as he or she used to be before contracting the infection.
A nutritional support, including artificial milk for infants, is another key component of care and support for people living with HIV/AIDS and their families. HIV and AIDS have a greater potential to deteriorate the well-being of the people living with HIV/AIDS and their families. The family package contributes to the socio-economic empowerment and capacity development of individuals and cooperatives through income-generating activities and provision of ongoing sustainable support for poverty reduction.
The most important challenges I had were linked to poverty in general, especially lack of sufficient manure and lack of assistance. Even when there was good harvest, it was not enough to pay for school fees, food, and other necessities. Financial assistance that I get helps me pay, though not fully, my children's school fees. There is significant improvement despite the subsistence of difficulties. We received training and a grant of 300,000 Rwandan francs in the teams within our associations. We distributed this amount to the first group of 30 persons. I decided to add some money I earned from farming and bought the cow you can see.
We have a group which weave baskets to earn income, and others who make pearls, and others who indulge in various activities. We have made progress. At household level, we can manage to solve some of our daily problems. We were trained on many skills. We were taught to create career jobs, to join small associations, and have access to bank loans. All this produced very helpful results.
It's a lot. I didn't know that it is better for an HIV-positive person to grow vegetables than to eat meat. Now we have our fertile vegetable gardens. In short, our nutrition has improved compared to what it was before.
Despite the concerted efforts and achieved results, the family package remains always confronted to enormous challenge born with unmet needs.
There are people who take drugs called Stocre. When you take these drugs on an empty stomach at night, you spend the next day in dizziness, as if you were drunk. I would not tell you that I can do anything the day after I'd taken the drugs on an empty stomach overnight. If you found us busy, it is due to last night's meal.
Were I a donor, in general, I speak on my behalf and on my colleagues. I would provide people under antiretroviral treatment something complementary so that life comes back to normal.
We have constraints such as lack of market for our products. Our supporters should help us access markets, sell and make benefits to develop ourselves, and prevent begging and spreading of complaints here and there. Instead of giving fish to someone, you better teach him or her fishing. I am of the view that we should be taught skills that would help us make a living on our own, rather than expecting charity at all times. Difficulties are still many, despite the many people who have responded to the PMTCT and have tested HIV positive. We therefore call upon those in the rural areas who have not yet enrolled in the program to come out and benefit from the family package program after voluntary HIV testing.
The family package was initiated as a pilot project which has efficiently worked out and is being adopted as a national policy. Therefore, the commitment of all partners will be a paramount importance to sustain the government's plan to extend the family package programs countrywide.
The family package project, initially implemented, is only one health center with around 168 beneficiaries and their families. To date, it is implemented in 7 health centers and benefits a little more 1,600 families. According to the beneficiaries, the project is highly appreciated, and so we intend to extend it to more health centers.
I think that this is a program that made proof of efficiency. HIV and AIDS is a development issue, as the economic development and economic welfare for families component is crucial. We will therefore ask our partners to always address HIV and AIDS prevention in the context of development. It is the only sustainable solution.
It might be true that many donors can say that HIV prevalence is less important in Rwanda than in other African countries. It is rightly now that all efforts must be done to maintain the low prevalence rate and, if possible, reduce it.
Special thanks to UNICEF, which tirelessly encouraged us to scale up our initiatives since we started.
Yes, this is UNICEF and Imbuto Foundation concern. However, the more effort that remains to be put into goes certainly beyond what UNICEF and Imbuto Foundation alone could give.